Good evening, ladies and gentlemen. Thank you very much for joining me today in this webinar on natural treatments for endometriosis according to Ayurveda. Now, of course, this type of this type of condition existed, in ancient times. And so it was something that, Ayurveda was aware of and treated and seemed to have a very good understanding of it. They called it kapha of Rita Rakta. Kapha is a thick, heavy, dense quality, which, of course, this is the thickening of the endometrium layer inside the uterus. And Avrita means the female reproductive system, in this case, the uterus, and Rakta means blood. So this is because we know when there's layer on layer of the endometrium tissue building up inside of the uterus, there becomes pockets of blood. So this was the traditional name given to this condition in Ayurveda. And it comes from the weakening of the endometrium, the lining inside the uterus. And this is due to improper lifestyle, imbalance of dosha or vata pitta kapha, and diet, incorrect diet. And of course, we know it's a kapha condition because this is a non-malignant growth. It's growing throughout the body, or at least in the pelvic area around the, pelvic and abdominal cavity outside of the uterus, if it goes outside the uterus. So it's a type of non-malignant growth, we could say, in Ayurveda. So that's his kapha. So it's a kapha condition, and that's why the endometrium is dense, heavy, thick, and having kapha qualities. So, in Ayurveda, there's two types. It's either by vata, pushing kapha, which in this case, the symptoms are slightly different. There's more pain in different areas of the body, pelvic area, lower abdominal, rectal area, vagina, and lower back. And there's pain often in the later cycles of the menstrual cycle, in the later part of the cycle, and often during intercourse and ovulation. And anxiety, fear, and insomnia, and often constipation are included. That is the vata imbalance. So this is the qualities of vata, the mobile, active, dry qualities, drying out, in a sense, the uterus and creating a type of environment that's increasing this kapha, not allowing the endometrium tissue to be completely removed from the uterus during menstruation. So then there's layer upon layer of endometrium tissue building up over the months. And a lot of times this is even creating pockets of blood. And when there's more bleeding and more pain, particularly burning pain and heavy menstrual flow, and even bleeding between the periods, or even bleeding after sexual intercourse, or even bleeding during urination, then we know it's pitta pushing kapha. So in Ayurveda, there's two main types. We know it's a kapha dominant condition, so kapha has to be reduced. So this means reducing the kapha is like shrinking the endometrium tissue, reducing it down, just like an overweight kapha prakriti type of person needs to lose weight and reduce body fat. If you have tumor, cyst, fibroid, this is also a kapha condition, and there needs to be a reducing action. So there's often a kapha balancing diet with no meat, no eggs, and less fatty food, and more cleansing and reducing types of fruits and vegetables and grains. And then the second element, of course, is whether it's vata or pitta. And when it's pitta, there's, like I said, much more bleeding, particularly heavy menstrual bleeding. And the pain tends to be more sharp. And there tends to be heat and even burning sensations when there's more pitta. And it spreads much quicker in the Pitta type. So those are the two types. And like I said, it's this, this thickening of the endometrium tissue inside of the uterus that then goes outside the uterus in a Vata type case and can spread inside the pelvic and abdominal cavity, and to even attach onto other organs, even the fallopian tube. And of course, it leads also to fertility, not because the woman's not fertile, but technically because the sperm has greater difficulty to impregnate the egg because of all this endometrium tissue. That poor sperm, he can't quite get there, and he tires out before he makes it. So there's a type of infertility aspect to it, or we could, more difficulty in being pregnant. So this is, first is, and then of course it can, if it's Pitta type and there's bleeding, then even the endometrium tissue, because Pitta is hot and sharp in its qualities, and particularly if the person's eating a Pitta increasing diet like spicy foods, hot foods, tomatoes, eggplant, bell pepper, and other sour foods, then this can even, the endometrium tissue can go through the uterus wall. And this becomes, of course, even more painful. So once it's outside the uterus and it spreads, of course, it's more difficult to treat, and it can create scar tissue. And sometimes this needs to be removed with surgery. Now, if we talk about the, etiology or causes of this condition, which are always important to understand these causes, of course, we'd know that it's often due to what we call delayed pregnancy, which means, without a middle-aged woman who's not been pregnant is more susceptible to this condition than a woman who's had been pregnant and whose menstruation has stopped for some time and she's had children. So if that's any consolation to you, then pregnancy is a cure. But if we speak from the Ayurvedic perspective, we know that increased kapha is coming from, or this increased growth of tissue, in this case, the endometrium lining, is coming from low agni, poor digestive fire. So the same woman is going to have poor digestion, maybe no appetite, and ama, or toxins or accumulation, which can be seen on the tongue. And often there can be weight gain, even for a thin woman, around the hips, the thighs, and the lower half of the body. And there can be more sluggishness, fatigue, low libido. These can be other symptoms because the kapha is building up in the rasa and in the lymphatic liquids, tissue, or lymphatic system, we could say, the lymphatic fluids of the body. So, foods that increase kapha, and particularly this lymphatic liquid, are going to contribute to this condition, such as yogurt, fruit juices, and eggs, meat, are also increasing kapha. So there has to be if the person's overweight, if the woman's overweight, it's almost easier. Then we can do a little weight loss at the same time, because we want to lose weight and shrink, reduce down the endometrium, and reduce down this rasa, this liquid in the body that's contributing to the kapha. And we want to increase the digestive fire. So if we talk from an Ayurvedic perspective, we want to reduce kapha, or weight in this case, increase agni, digestive fire, and do like a dipana, something before the meals, like trikatu, ginger, black pepper, before, or even black pepper with a little ghee before the meals, or water with lemon, to increase the digestive fire. And then after meals, we do a likanam, which is, a reducing therapy, something that's scraping, cleaning, and reducing down the fat tissue and the accumulation of tissue in the body, and in this case, the endometrium. So if a woman had fibroids and at the same time had endometriosis, then the treatment would be very similar, because both were trying to reduce So, of course, diet, not snacking, and exercising would be very important. The correct diet um, would be help. And then, of course, there's the two types, Vata type, Pitta type, and these would also have by diagnosing and determining whether it was Vata or Pitta type, then that will also affect the diet and, of course, the herbal treatments. I'm going to go into the herbs next, which is really, critical for this condition, even though diet and exercise are very helpful. But the one good home remedy is flax oil. And flax oil pack can be put over the uterus and like soaking a hand cloth in flax oil, putting it over the uterus, and then maybe put a little plastic over that, and then put a heating pad or a hot water bottle on top of that and lying on your back. Of course, in Ayurveda, we call it basti, and that is this basti in this case means bladder, but that's just what they call it. And they use a flax oil basti where they just make like a little rim of wheat flour and water, so it's like a little rim around the uterus area, and then just fill it up with hot flax oil and allow the woman to lie there for 1 hour. And if this is done repeatedly, this flax oil goes in. And we know flax is reducing kapha. It's also used for fibroids. The same basti or flax oil hot packs is used for reducing and breaking down fibroids, as well as helping to manage and reduce down the endometrium tissue, particularly when it starts to spread in the abdominal cavity, and we're trying to reduce it down. So there's really 3 levels of treatment: the diet, which could be, say, Vata Kapha diet or Vata Pitta or Pitta Kapha diet, depending on the individual, and then some home remedies like exercise and these flax oil hot pads. That would be the home remedies. And now when it comes to the herbs, of course, it varies depending on the woman and her condition. We have certain formulas that are made here, and we have certain herbs that are used. The main herb that's used for this condition is we call Ashoka. Ashoka means it's an astringent herb, so astringent is used to tighten up tissue, and it has a reducing quality. It's also used in weight loss, Ashoka. But Ashoka means friend of woman. It's used in many Ayurvedic formulas relating to menstrual conditions of women. And in fact, if the woman's very dry and very thin, we actually have what's called Ashoka ghee, which we just call female ghee. But it's also good for a female libido. And there are a few other herbs in there, like cumin, for help you to digest the ghee, and bala, and yastimadu licorice, and a little ashwagandha. But the main herb is Ashoka, cooked in ghee. And it's also, like I said, used for female reproductive system. But in this case, we would use it not for an overweight woman with oily skin, but a woman with dry skin and underweight, but we want to get this Ashoka in. Now, we have a formula here we call uterine anti-inflammatory formula. It's mostly for the pain, and this one is particularly for more pitta type of conditions where there's excess bleeding. So you can see it's used for fibroids, ovarian cysts, painful periods, and endometriosis. And it's called Pushang Churna in Ayurveda, and it has 29 herbs in it. One of those herbs is Ashoka. And this is a common formula used in Ayurveda, Pushang Churna. And it's an anti-inflammatory formula, particularly for the uterus and female reproductive system. Not in itself a cure of this condition, but often used in conjunction with other herbs. If there's very heavy bleeding, we have another formula here, and we call it, menstruation formula excess. And you can see the first ingredients is Pushang Churna. It's just that some other herbs have added. There's Ashoka, which I just showed you. So this would be like very heavy bleeding, irregular menses, and spotting between the menstruational cycle, and just severe PMS symptoms. And there's Ashoka, Lodra, and Guduchi. Guduchi is anti-inflammatory. Shatavari is cooling and helping to balance hormones in the female reproductive system. But the main formula still is this Pushang Churna. It just has some extra herbs in it to give it even more effect. Very effective. Most women have never done more than 1 or 2 jars, and as long as they follow the proper diet. In that case, when you have excess bleeding, a woman shouldn't have hot foods, spicy foods, chili peppers, tomatoes, garlic, raw onions, particularly raw garlic. We've seen some women, they're doing a lot of raw garlic, raw onions, chili pepper, and they take that herbs, change the diet, and this whole excess bleeding issue and pain during menstruation reduces down. Now, in the case where the menstruational cycle is absent or delayed, or the time between menstruation is too long, which can also result in pain, but more of a cramping type of pain. Well, we have this formula here, and there we got Punarava Mandir. We're going to talk about Punarava in a minute. Chandraprava, Shatavari, Ashoka is in there. Lodra is also used for a lot of female formulas. But the difference with this one, Chandraprava is another formula, and it has Shilajit in it, Gugulu, and it's we actually sell it here, and we call it like cleaning formula. So it opens up the urinary tract. It's good for urinary tract infections. It opens circulations. It's got a scraping, cleaning property to it, Chandraprava, but it's not too hot because Chandra means cooling. So it's got this quite strong clearing capacity. In fact, by itself, Chandraprava can be taken for just many bladder and kidney conditions where there's lack of urination, blockage in the urinary tract, and even urinary tract infections. But in this case, it's helping to open up the reproductive system and increasing the flow. Now, of course, there's timing involved in taking these herbs related to the woman's menstrual cycle. Many of them we take in the second half of the menstrual cycle and not in the first half. So there's a few tricks there. So those can be used. But in the case of endometriosis, we often use the herb. We have some formulas here, and one of them is Punarava. And Punarava is used for weight loss, swelling, water retention, and it's reducing by nature. So a good formula for endometriosis, a general formula, Punarava, because this has got this reducing. It's used in weight loss. It's also a diuretic. It's got a scraping, cleaning quality to it, which we want. Ashoka, which is one of the best herbs for a woman. It's got a stringent quality. It's also used. It's got this reducing quality. And then we use Shilajit, which we have in little capsules. They come in little capsules like this, Shilajit balls. It's mineral, trace minerals, and they have cleaning and scraping qualities. And they're in Chandraprava, by the way. So if the woman was very hot, burning, and we would use the Chandraprava instead of the Shilajit. And then we can use other little spices because like tricketu, ginger, black pepper taken before meals or even after meals to increase the digestive fire, because this is one of the main cause is this poor digestive fire, the accumulation of ama and toxins, and then of course this excess growth in the uterus. So the digestion has to be good. And so often we put in herbs that would help improve the digestion. And of course, we have a formula already made, but ginger, black pepper could also help. See, this is kapha post because this is a kapha condition. So these are pretty hot. Chikrap mul is one of the best herbs for post-digestive. And there's a tricketu. Tricketu is made of ginger, black pepper, and long pepper. So this is taken after meals. This will start increasing absorption of nutrients, helping to burn fat, helping to keep the digestion strong, and prevent more of this growth taking place due to poor digestion and accumulation. And the woman will also have more energy, will feel more light, won't feel so heavy after meals, and will probably be losing weight. Now, we also have different, herbal teas just for if there's a lot of cramps going on. We may also provide, our PMS tea, which is Western herbs. Red raspberry leaf, this is a uterine tonic, one of the best herbs for women. Many Western women in the last few hundred years have had red raspberry leaf during and prior to menstruation to help relieve them from the cramps and symptoms of menstruation. But we put a little more in there. Passion flower, nervine, relaxing. St. John's wort, also relaxing, helping with mood. Lavender, it's a slight nervine, but makes it smell nice. White willow bark, very astringent. Wild yam and dong quai and chasteberry are all phytoestrogens, helping to balance hormones. And feverfew is more for like a headache and inflammation. So we have a couple different ones. We have another one, it's a simpler one, PMST, and we use this one is without the phytoestrogens. This is to help with cramping in the nerves, but doesn't have the phytoestrogens. Particularly, we use that in the case of fibroids. So that is the scope of the treatment, and every woman would receive a different treatment. No woman would receive the exact same herbs. And in fact, I asked them to go through their menstrual cycle 1 month, and when they come back after going through the menstrual cycle for 1 month, we often change a lot of the herbs because there may be no more heavy bleeding, there may be no more cramping, but we know that the endometrium tissue is still there because this treatment takes 3 to 6 months, and it's a very stubborn condition. It takes some time. So even if we manage the symptoms and there's less bleeding or there's more regular menstrual cycle, doesn't mean that we've completely resolved the condition. And unfortunately, some women, they don't continue with the treatment because the symptoms get better, their menses becomes more regular because we use the herbs to help manage that, and then they don't continue to take some of the more critical herbs to reduce down the endometrial tissue in the body. And often women have to resort to surgery for this condition or other medical means. But if it's caught in the early stages and it can be detected through ultrasound, then treatment is much, prognosis is much better if it's detected in the early stages. In the later stages, if the endometrial tissue is spread all over the abdominal cavity and is attached to many organs, including the colon, the bladder, then of course, reducing this down is going to take longer and be more challenging, and possibly surgery will be a better option. So if you suspect or you've been diagnosed with endometriosis, even in the early stages, then I'd recommend that you get proper treatment early before it becomes more severe and more painful, and where maybe surgery is the only option remaining. So there is hope. I've been very successful with this condition. And of course, there's the two variations in herbs. If it was more pitta, then, I would use other herbs like musta and even guduchi sattva, which is cooling, particularly if there's a lot of heat and a woman's getting hot flashes. Manjista, which is good for skin tissue and our skin, but it's also a cooling herb and helps in reducing tissue without using heat. And if the endometrium tissue has grown quite a bit, we may put in include kaishar gugulu along with our treatment, because the gugulus are the best for breaking down tissue and reducing it. And kaishar gugulu is the cooling one. And for a vata person who's more cold and dry and light, then we would use yogaraj gugulu. So these would be like to knock the treatment up to another level that's more advanced, where it's already, there's excessive growth, we're not in the early stages, then we'd add one of these gugulus onto it. So there's all types of variations in these herbal formulas, and often, each month the formula needs to be modified, and the woman needs to go continue for, minimum 3 months and up to 6, 7 months, taking these herbs, following the diet to, resolve this condition naturally. Okay, so I hope that helped give you hope. Hope you help understand the condition better. And if you do have this condition, please feel free to contact me. I'm happy to discuss your case and speak to you about what can be done. Once again, ladies and gentlemen, thank you very much. And I look forward to assisting you.